Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bisht, BDS by degree and a pharma professional. As a founder of CareerInPharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey.
Hello everyone. Once again, I welcome you all to Career in Pharma and I welcome you all to another episode of important interview questions for pharmacovigilance. Now in today's video, I'm going to explain you few case scenarios where we will understand in that case scenario, what is the Dechallenge, what is the Rechallenge, what is the suspected drug, what is the suspected event, and what is the causality assessment and the rationale behind the causality assessment. That I'm going to explain you through few case scenarios today. Now again, it is important interview question because in many interview of pharmacovigilance, apart from asking you Dechallenge, Rechallenge, causality assessment, they may give you case scenario also. So it shows how much understanding you have about these concepts. Yes, so let's begin. And here I'm going to share my screen where there are few case scenarios written. Through this, I'm going to explain you all the case scenarios. Yeah. You have been given any case scenario, you need to understand that is all about drug and disease. So your pharmacology should be good without doubt, because one of the factor which you look for while assessing the causality is the pharmacology of the drug. So if you are anyone who is not from pharma background, if you don't know pharmacology, if you don't have a good medical understanding, then pharmacovigilance is not for you. In that case scenario, you can go for clinical research profiles or data management, which I regularly tell in my videos as well. Because for pharmacovigilance, causality assessment, pharmacovigilance cases, ICSR case processing, definitely it is always better to have a good command on medical subject and to have a good pharmacology knowledge. And also to assess these case scenario also, you should be good in pharmacology. You should understand about which class of drug we are talking about. Yes. So here I'm going to explain few case studies, and after reading each case, I will tell you what is the suspected drug, the suspected event, and the causality assessment for each of the case study. Then I will also provide you the rationale behind my causality assessment, and then I will also tell you what is the Dechallenge and Rechallenge in these examples, and if it's not provided, that also I'm going to tell you. Now, very important note, while assessing causality, definitely you should be knowing about the pharmacology of the drug. Means you should be aware of the common side effect of any given drug. That happens because of the way they behave, because of the mechanism of action of the drug, and because of the pharmacology of the drug, which is very important. Now, case scenario 1 is where a 56-year-old male was on rivaroxaban. Now, what is rivaroxaban? When you Google it, you will get to know it is an anticoagulant. Now, for all pharmacology people, you know how anticoagulant works, what are the common side effects, right? So, in this case scenario, a 56-year-old male was on rivaroxaban for past 1 year. Yeah. And on 5 August 2021, the patient had nose bleeding. Now, in this first para itself, one thought must be coming to your mind is rivaroxaban is an anticoagulant. And in anticoagulant, this bleeding thing is very common. So, this thought will come into your mind when you are aware of pharmacology of anticoagulants, right? So, in second line, patient went to his family doctor, rivaroxaban stopped immediately, and the nose bleeding also stopped. And there was no requirement of any further treatment for nose bleeding, as it was stopped after stopping rivaroxaban. There was no other drug history and no medical history present. Now here, short, rivaroxaban was responsible for nose bleeding because In this case, suspected drug is rivaroxaban. Suspected event is nose bleeding. Now, Dechallenge was positive because immediately after stopping rivaroxaban, nose bleeding also stopped. And also, the pharmacology of the rivaroxaban, the mechanism of action, the way rivaroxaban works, it may lead to bleeding. So, it happened because of rivaroxaban only. So the causality assessment is positive and it happened because of rivaroxaban, suspected drug rivaroxaban. Suspected event, nose bleeding, Dechallenge positive, Rechallenge not performed because it was already cleared through Dechallenge that rivaroxaban caused nose bleeding. And there was no other concomitant medication present, no concurrent illness present, so that we can tell any other factor also responsible for the nose bleeding. Okay, so I hope this case scenario number 1 is very important. So what you have to look for: pharmacology of the drug, Dechallenge results, Rechallenge results if performed, and what is the suspected product and the suspected event. Now case number 2. Now case number 2, where a 65-year-old female had generalized itching, right? And we all know cetirizine is a drug it's a commonly prescribed drug for itching. So the patient had generalized itching and the patient took cetirizine after consultation with her doctor. Now after taking cetirizine, itching was improving and the patient was feeling sleepy. And because of the sleepiness, the patient was not able to concentrate in her work. So she went again to her doctor and doctor told patient to stop cetirizine and tell her to come in follow-up visit. Now, after stopping cetirizine, sleepiness was not there, but again itching started. Now here, don't confuse that what is the suspected event. Suspected event is not itching here, right? Itching is something happened in the patient, after that patient took cetirizine. So suspected event here is sleepiness, okay, not generalized itching, and happened because of cetirizine. So suspected product is cetirizine. Now Dechallenge is positive, means after stopping cetirizine, sleepiness stopped. So Dechallenge is positive, but as the patient took cetirizine for itching, so itching again started happening. Yes. So in this case, suspected product cetirizine, suspected event sleepiness, not itching. Dechallenge positive, yes, it is because of cetirizine, because the pharmacology of the cetirizine. The mechanism of the cetirizine, all antihistamines, they causes drowsiness, sleepiness in patient. Yeah, and already mentioned there was no other medical history or drug history for the patient. So this is case number 2. Now case scenario 3. A patient was on chemotherapy for blood cancer and was on treatment with vincristine, methotrexate and cyclophosphamide. Now after 1 year of this chemotherapy, the patient had very bad nausea and vomiting. Now people who are from pharmacology background, medical background, they must be knowing that nausea and vomiting is a very common side effect with all chemotherapeutic agents. So the patient had very bad nausea and vomiting, and the patient doctor stopped all the 3 agents. And after stopping all these agents, nausea and vomiting stopped. So it is clear cut because of these chemotherapeutic agents. So here in this example, suspected products are vincristine, methotrexate, cyclophosphamide. Suspected event is vomiting and nausea, and Dechallenge was positive, and causality assessment positive. It was because of the chemotherapeutic agent only, because entire case scenario is in favor with chemotherapeutic agent causing these effects, and also because of the mechanism of the action, because of the pharmacology of the chemotherapeutic agent, we know that the nausea, vomiting, these are very common side effect with any chemotherapeutic agent. Now case number 4, that is the last scenario, where a 80-year-old female was having headache. Now after having headache, she took some over-the-counter drug, and after that patient had vomiting. Now patient went to some nearest doctor and the doctor told to stop the OTC drug, and after stopping the OTC drug, vomiting stopped. Now in this case scenario, we can't tell what is the suspected drug, what is the suspected event, right? Suspected event we can say, because here they are saying that after taking some OTC drug, patient had vomiting. So suspected event is vomiting, but we don't know what OTC drug the patient took, right? So we don't have any idea what is the suspected product. Suspected event is vomiting, and also we can't assess causality here because we don't know which medicine the patient used. Although Dechallenge is positive, but again, in this case scenario, we don't know anything, so we can't give any causality assessment. Any final causality assessment can't be given. Yes? So this is all about this case scenario where we understood what is suspected product, what is suspected event, what is Dechallenge report, it's positive or negative, Rechallenge perform or not, and also we assess the causality. Now these kind of case scenario, interviewer may ask you in interview also. There may be a little bit here and there. Definitely you can make more case scenario like this for yourself if you are a person from pharmacology and medical background. Definitely it's not tough for you to make these kind of case scenarios, but be prepared well with these kind of case scenarios which interviewer may ask you in your pharmacovigilance interview. Yes, so that's all in this video, about this video where I explained you case scenarios, and I hope it becomes simple for you now how to find more case scenarios, and I hope it give you more clarity on what is Dechallenge, Rechallenge, suspected product, suspected event. Yes, so with this I'm going to conclude this video. We'll be coming soon with some fresh next video. Till the time I come again, till that time please stay safe, aware, healthy and updated, and keep exploring new things. And please don't forget to subscribe to our channel and hit our like button. Yes, so we'll be coming soon with some fresh next video. Yeah, bye bye, have a nice day.